This is part two to a video of the common medications that we use after cardiac surgery. In the first video, I talked about continuous infusions mainly on post-op day zero, but let's talk about the really important oral medications that are used that have shown a benefit after cardiac surgery. Let's talk about aspirin because that is the one that probably has the most data and has shown to improve graft patency in patients after cardiac surgery, and they actually recommend to start it within 6 hours post-op. Things can change, and obviously a patient can bleed a lot after cardiac surgery, and in those patients, their benefits might not outweigh the risks in terms of starting it earlier than later. But if you have a patient that's otherwise doing well after surgery and you can administer it within 6 hours, you probably should. P2Y12 inhibitors such as clopidogrel or ticagrelor or prasugrel have a little bit more controversial data in terms of it being a benefit versus not a benefit. There's some data to support that aspirin combined with clopidogrel after an operation can improve graft patency rates and also can improve cardiovascular outcomes. But there are conflicting studies, and you'll see that some surgeons might practice differently than others in terms of adding AP2Y12 inhibitors such as clopidogrel. Let's next talk about beta blockers, and these are incredibly important after cardiac surgery. Beta blockers have a lot of data that continue to show their benefit in patients with heart disease, but after CABG, it has been shown that if they are getting a CABG secondary to a myocardial infarction, that it improves their outcomes. But even if you don't have a history of myocardial infarction, and that's the reason why you're getting a CABG, these patients still have a benefit when given a beta blocker because it reduces their incidence of postoperative atrial fibrillation. Let's next talk about statins, and they are super important as well, and they should be given to nearly all patients after a coronary artery bypass graft. Statins are important because they have also been shown to improve outcomes after cardiac surgery, and it has been shown that higher doses of statins, meaning high intensity statins, have been shown to have a higher benefit than lower intensity statins. I made a video previously on how to distinguish between high and low intensity statins, so make sure to give it a watch. But when you use a high intensity statin to reduce a patient's LDL less than 70 after cardiac surgery, these patients have been shown to have a benefit. And if you can't achieve a LDL less than 70 in these patients, then you might have to add another agent such as ezetimibe, otherwise known as Zetia. Some other miscellaneous medications that you might see depending on your surgeon are amiodarone, and that is also used to prevent postoperative atrial fibrillation, although the data isn't as strong compared to beta blockers. There's ascorbic acid, otherwise known as vitamin C, and this has been shown in some trials to reduce ICU length of stay and to reduce time to extubation. And the thought process behind that is to reduce inflammation because it's an antioxidant. You also might see amlodipine or diltiazem, and these medications are utilized if your patient got a radiograph as opposed to using Safini's grafts. And because radiographs have a higher incidence of spasms happening, and so amlodipine and diltiazem, what they do is they help reduce the amount of spasms that happen due to their calcium channel blocker activity. Let me know if I missed some, or if your surgeon uses different ones. I'd be happy to talk about it.